Hi, my name is Paliz, and today I'm going to talk about urinary tract infection in older men. Definition: urinary tract infection is one of the most diagnosed infections in older adults and the most common reason for antimicrobial prescriptions in nursing home residents. Older patients often present atypical symptoms and occur when bacteria in urethra, bladder, or kidneys multiplies in the urine. UTIs are also a leading cause of sepsis, an extreme and potentially life-threatening bodily response to an infection.
Hello. Today we are going to answer some frequently asked questions about urinary tract infections, or UTIs. UTIs cause more than 8 million visits to healthcare providers each year. About 1 in 2 women and 3 in 25 men will have symptoms of at least one UTI in their lifetime. What is a UTI? A urinary tract infection happens when bacteria grows in your urinary tract, which includes your kidneys, bladder, and urethra. Bacteria may get into the urine from the urethra and travel into the bladder. They may even travel up to the kidney, but no matter how far they go, bacteria in the urinary tract can cause problems. What are the symptoms of a UTI? Symptoms of a UTI are different for everyone, but can include burning or pain with urination, frequent urination, lower back pain, cloudy or smelly urine, pelvic pain or pressure, and fever. And symptoms vary depending on what part of the urinary tract is infected. If the infection is in your kidneys, you may experience upper back or side pain, high fever, shaking and chills, nausea, or vomiting. If it's in your bladder, you may feel pelvic pressure, lower abdominal discomfort, frequent painful urination, or blood in urine. If the infection is in your urethra, you may have burning with urination, discharge, and post-void urethral discomfort. Why are UTIs more common in women? Just as some people are more prone to colds, some people are more prone to UTIs. UTIs are more common in women because they have unique risk factors, like having a shorter urethra than men, so bacteria has a shorter distance to travel to reach the bladder. And certain birth control methods that women may use, and menopause, can also cause UTIs in women. Also, women are more prone to lower urinary tract infections due to anatomical differences, because the rectal area, which can be a reservoir for bacteria, is in close proximity to the vaginal urethra area. How are UTIs treated? A UTI can usually be treated with a short course of antibiotics. Pain and the urge to urinate often go away after a few doses, but it is very important that you still take the full course of medicine even if you feel better. Unless UTIs are fully treated, they can often return. How can I prevent UTIs? There are a few steps you can take to avoid getting urinary tract infections. Drink plenty of liquids, especially water. Empty your bladder soon after intercourse. Don't hold your urine for too long. And for women, avoid potentially irritating feminine products. Wipe from front to back. Choose a different contraception method because diaphragms and spermicide can lead to more UTIs. So there you have it, all of the basic information about urinary tract infections. If you have more questions about UTIs, visit our website at urologyhealth.org.
Applications in medicine. UTI is one of the most commonly diagnosed infections in older adults. It is the most frequently diagnosed infection in long-term care residents, accounting for over a third of all nursing home-associated infections. It is second only to respiratory infections in hospitalized patients and community-dwelling adults over the age of 65 years. Risk factors for developing symptomatic UTI in the aging population are age-associated changes in immune function, exposure to nosocomial pathogens, and different types of comorbidities put the elderly at an increased risk for developing infection.
Hey guys, I'm Jenna Ryan, CEO and co-founder of Ucora, the UTI prevention company. We are talking about some of our customer stories. This one in particular is about UTIs in older adults. UTIs can be really different as we get older, and so I wanted to chat a little bit about that. So Cynthia from Oregon says, my older mother was getting recurring urinary tract infections, and they were often not identified until they were very severe. Her symptoms include fatigue, mild fever later in the infection, swelling, and back pain, but not the usual burning when urinating. One time she even had to be hospitalized overnight because she'd become incoherent due to the severity of the infection. The cycle of antibiotics and then the bacterial overgrowth afterwards was horrible. Eucora has stopped all that, and we're very relieved. She has to take it every day, but it's absolutely worth it. So I wanted to chat about a few things there. First is that UTIs in younger people often present with burning, with urination, and a frequency in an increased frequency of urination. You probably are familiar with that sort of burning telltale signs. But as we get older, sometimes those symptoms stop to show up in the way that we're used to seeing them. And in some cases, in older adults, UTIs can cause symptoms that seem like dementia even. People can be disoriented, there's a sense of delirium, sometimes a loss of balance. And so we hear from people a lot who thought that their mom or dad that they were taking care of had something else happening, more like dementia or memory loss. And in the end, it was a UTI that wasn't detected early on. So definitely be aware of any of those sort of personality changes in older adults that you might be taking care of or responsible for. And know that Eucora is a great way to get ahead of UTIs and avoid that cycle before it starts.
Issue applied in Ecuador. Urinary infection is a problem that is frequently seen in the elderly, where the incidence reaches up to 50%. This higher incidence of UTI in the elderly has several reasons. In the case of men over the age of 50, the appearance of prostatic adenoma, prostate enlargement, causes a low obstructive uropathy, while in women, the hormonal change typical of menopause increases probability of infection because it changes the balance of the bacterial flora.
A urinary tract infection, or UTI, can occur in any part of the urinary system. Women are more likely to get one than men as their urethra is shorter, which means any bacteria has less far to travel. Dark, smelly urine is not a sign of a UTI, but it may indicate that an older person is becoming dehydrated. A dipstick urine test is not an accurate way to test if a person aged over 65 has a UTI, because they are far more likely to have bacteria in their urine already. This can lead to a false positive test result. A daily fluid intake of at least 1.5 litres may help to flush the bacteria away and reduce the chance of a UTI. A suspected UTI should be based on clinical signs and symptoms as per national guidance. Run through this checklist. Does the older person have 2 or more of the following as new symptoms? Confusion, agitation, drowsiness, or worsening of these conditions. Shaking or chills with a high temperature above 38 degrees C or low temperature below 36 degrees C. Painful or difficult urination. Needing to go to the toilet quickly. Needing to go to the toilet more often than normal. Incontinence. Blood in the urine. Correct diagnosis and the prevention of UTIs leads to improved quality of life,
Yippee!
reduced hospital admissions, and reduced use of antibiotics.
Pros. UTIs can be treated. The International Clinical Practice Guidelines, updated in 2012 by the Infectious Disease Society of America and the European Society of Microbiology and Infectious Diseases, recommend nitrofurantoins monohydrate macrocrystals 100 mg twice daily for 5 days, or trimethoprim sulfamethoxazole 160 or 800 mg twice daily for 3 days. Cons. As the population ages, the burden of UTI in older adults is expected to grow. If left untreated, a UTI can lead to acute or chronic kidney infections, which could permanently damage these vital organs and even lead to kidney failure.
I'm Dr. Ryan Stanton, and it's time to find out what's going around. Recently, it seems that there have been plenty of elderly in the emergency room with the symptoms associated with urinary tract infections. In the young and middle-aged, UTIs are characterized by painful urination and low back pain. In the elderly, however, the symptoms may be much more indolent. In fact, in elderly, the most common symptoms are confusion, fatigue, altered mental status, falls, and generalized weakness. In fact, when I see an elderly patient in the emergency department with acute confusion and lethargy, a UTI is at the top of the differential list. Elderly are also high risk for urinary tract infections because of incontinence, incomplete emptying, obstructions, prolapse, and difficulties with hygiene. In severe cases, a UTI is a source for life-threatening sepsis in this population. The key is a low threshold for testing and culture. A urinalysis is an easy and usually non-invasive test that can give quick information and diagnosis. The culture can help us identify the bacteria and what medications will be the most effective in treating it. In the vast majority of cases, the infection can be treated at their home or long-term care facility. Sometimes, however, admission is necessary to get IV antibiotics on board and support the patient through the initial stages of recovery. If you or your family member is prone to infections, it's very important to get investigated and the causation and attempts to correct it as able. You can join the conversation on Facebook at our Stanton MD page and at Everyday Med.
In conclusion, urinary tract infection is one of the most commonly diagnosed infections in older adults and the most common reason for antimicrobial prescription in nursing home residents. Older patients often present with the typical symptoms, making the differentiation of asymptomatic bacteriuria with symptomatic UTI challenging. Overutilization of antimicrobials for suspected UTI remains a significant problem and leads to negative consequences, including development of multi-drug resistant organisms.
I am an experienced carer, and I work with Mr. D, who has been living with dementia for the past 5 years. In a visit to Mr. D, I noticed a sudden and unexplained change in his behaviour, such as increased confusion, agitation, and withdrawal. I contacted his doctors, who informed me that the symptoms he was having could be from a UTI infection. A UTI is urinary tract infection, and this can cause the elderly, and especially those with dementia, to experience sudden confusion or delirium. The most common way to test for UTIs is through a urine sample. So what can cause the urinary tract? Urine is normally sterile, does not contain bacteria, although in older people it is common to have bacteria in the urine, known as bacteriuria. This is because the flow of their urine is weaker, and they are less likely to empty their bladder fully. The person with dementia may not be able to communicate how they feel. Therefore, it is helpful to be familiar with the symptoms of UTIs and seek medical help to ensure they get the correct treatment. The symptoms of UTIs include at least one of the following: pain or a burning sensation when passing urine, the need to pass urine immediately, urgency, the feeling of not being able to fully empty the bladder, cloudy, bloody or bad-smelling urine, lower abdominal pain, urinary incontinence, mild fever, delirium, acute confusion, agitation. It's important to know that the symptoms of UTIs in the elderly are often mistaken for the early stages of dementia or Alzheimer's disease. The most common symptoms that indicate a possible UTI infection in the elderly will include confusion or delirium, agitation, hallucinations, unusual behavioural changes, poor motor skills, loss of coordination and dizziness or falls. So it's crucial to keep an eye out for any sudden changes in behaviour and mental state of elderly people in your care. Here are some tips that can help reduce the risk of a UTI. Drink between 6 and 8 glasses of fluid a day. Encourage the person with dementia to drink by finding their preferences and making drinks readily available and visible using a brightly coloured glass or cup. Monitor fluid intake for people who are less mobile and at risk of dehydration. Do not hold urine in the bladder for too long. People with dementia should be prompted to use the toilet on a regular basis. Make sure the location of the toilet is clear. A sign at the door with a picture may help. Maintain good hygiene. A person with dementia should be reminded to wash regularly and to change clothes. It is also important to be aware that any infection, not just a UTI, could speed up the progression of dementia, and all infections should be identified and treated quickly. Be vigilant.